proceeding will start shortly. The 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 proceeding will start shortly.
When they're not speaking in the debate, this is in line with current UK Government guidance and that of the House of Commons Commission. I can also remind members they're asked by the House to have a COVID lateral flow test twice a week if coming onto the estate. This can be done either at the testing centre at PCH or at home. And please also give each other and members of staff space when seated and when entering and leaving the room. Nick Fletcher to move the motion.
Thank you, Chair. It's a pleasure to serve under you today. I beg to move that this House has considered E-petition 578676 relating to access to salbutamol inhalers. I would like to begin by thanking the creator of this petition, Brian McAldry, who took the time to speak with me recently, as well as Elaine Cunningham, whose daughter Lauren Reid died as a result of an asthma attack she suffered while working in a commercial kitchen because she did not have access to her inhaler. I am also grateful to Asthma UK, which supports this petition and provided many of the statistics I will reference this afternoon. More than anything else, Lauren was known for her generosity. On the day she died, she called her gran to say that she was buying lunch for 10 of her co-workers. She was also a beloved Rangers fan. She loved music and, of course, cooking. She was devoted to her job and worked so hard that she finished her apprenticeship a year early. Lauren was only 19 years old. She had suffered from asthma since she was an infant. At 16, she became an apprentice in a restaurant in Glasgow, and 3 years later, she was a fully qualified chef. Her mum has talked about how Lauren kept her inhaler with her almost everywhere she went. But with severe asthma, one attack can have life-changing consequences. We do not know why Lauren did not have her inhaler with her or what triggered the attack, but on this occasion, she did not have it when her asthma flared up. The first Elaine knew of the incident was when she received a call from Lauren's boss to say she was struggling to breathe and needed her inhaler. The asthma attack led to cardiac arrest, and although her manager gave her CPR, she could not be revived. Lauren was hospitalised with severe brain damage. Her friends and family stayed by her bedside round the clock, but a few days later, Elaine had to make the heartbreaking decision to turn off her daughter's life support after doctors said she would never recover. Since then, Elaine has been campaigning for Lauren's Law, which would legally require salbutamol inhalers to be stored in commercial kitchens. The UK has one of the highest rates of asthma in Europe, and every year it costs the NHS £3 billion. We also, sadly, have one of the highest asthma death rates generally, nearly 50% higher than the European average. For people aged 10 to 24, it's the highest. Unfortunately, the rates of asthma nationally are going up, not down. In the UK, 200,000 people suffer from severe asthma. In Scotland, where Lauren lived, 1 in 14 people receive treatment for asthma, and in England that figure is 1 in 11. These statistics demonstrate that asthma is a relatively common condition, and while it is manageable for most people, it remains a serious risk for those who have it. I know most people with asthma are acutely aware of this fact and carry their inhalers with them. But Lauren's story shows that one attack without an inhaler on hand is enough to cause serious harm or even death. We've all forgotten something in our time, haven't we? Working in a commercial kitchen poses more of a risk for people with severe asthma than most other settings, which is why the inhalers would only be for staff, not for restaurant customers. Asthma UK considers a high-risk environment to be one where the triggers for asthma attack upon the respiratory system are exponentially greater than normal environments. In the case of commercial kitchens, these include the presence of inhalable materials like powders, flours, dust, and sometimes toxic fumes. Heating and humidity are also known to cause asthma attacks. Compounding these issues is the fact that stress can make a person more likely to react to asthma triggers, and I think most people would agree that professional kitchens are not known as a calm environment. One might be tempted to argue that if kitchens are such a dangerous place, then perhaps people with asthma should not work in them. But I do not think that is the only or best solution to the problem. Inhalers are an effective way to treat asthma attacks. They are self-administered and do not require any previous training. Adding one to the first aid kit that professional kitchens already have would be an easy way to make them a safe environment for employees with asthma. At the same time, salbutamol inhalers are prescription medicine, so keeping an emergency one on hand is not as simple as picking a spare one up from Boots. Keeping asthma inhalers in commercial kitchens would require an exemption from prescription control, which would have to be granted by passing legislation. The salbutamol inhalers currently in use have been licensed for over 2 decades. Their risks are well known. Side effects are typically mild and do not last long. When the MHRA, who I met with last week, looked at the effect of salbutamol inhalers on children, for instance, it found that it would not cause serious harm if accidentally given to a child without asthma or one whose sudden breathing difficulties were not caused by asthma. While overuse of salbutamol inhalers can sometimes cause problems, the petition only seeks to keep them in kitchens for emergency use, and their stocks could be easily monitored. We have a precedent for this already. Since 2014, an amendment to the Human Medicines Act has allowed schools to store emergency inhalers for asthmatic students. Asthma is not an uncommon condition, and working in the food industry should not be impossible for people with asthma. Keeping asthma inhalers in commercial kitchens is a simple, inexpensive way of reducing the chance that anyone else will suffer the same experience as Lauren. I am therefore asking the Minister whether the Government will commission research on the benefits and risk of requiring salbutamol inhalers in professional kitchens. This research could then be received by the MHRA, which would make its own recommendations on whether to change the law. I know this is a long process, and today's debate will not cause any immediate change, but I do hope that it raises the awareness and is the first step towards creating Lauren's Law. Thank you.
The question is that this House has considered E-petition 578676 relating to access to salbutamol inhalers. Margaret Ferrier.
Thank you, Mr Hosey, and it's a pleasure to serve under your chairship and to follow the honourable member for Don Valley. We keep meeting each other in Westminster Hall. So today's debate is of huge importance, and I'm grateful to the almost 2,000 of my constituents who took the time to sign petition 578676. My constituency had the second highest number of signatories in the UK, clearly showing how strongly the community in and around Glasgow feel about the petition's aims. The events that prompted this petition are devastating. We have heard how Lauren Reid, just 19 years old, suffered a severe asthma attack at work. Tragically, she didn't have an inhaler with her at the time and passed away later that week in hospital after becoming starved of oxygen during the attack. 19 is no age to pass, and I can't imagine how difficult it has been for Lauren's family and friends in the time since. It's horrible to think of this as preventable, but I do hope that today's debate can serve as a step forward to ensuring that these events are not repeated in the future. I know the honourable member for Strangford has another debate next week on asthma outcomes, which I hope will further contribute to the recognition of the seriousness of the illness and what can be done to protect sufferers. Before moving on to more general points in the matter, I would like to commend Lauren's mum Elaine, who has pursued Lauren's Law tirelessly throughout what will have undoubtedly been an exceptionally painful and difficult year. Her loss is unimaginable and her commitment is admirable. She has my full support in her campaign for salbutamol inhaler provision in commercial kitchens. Asthma is a common chronic condition. It's more common in Scotland and the UK than most other places in the world. Over 8 million people, or 12% of the population, have been diagnosed with asthma. And according to NICE, it accounts for 2 to 3% of all primary care consultations, 60,000 hospital admissions and 200,000 bed days per year. And interestingly, while it's more common in boys in childhood, it's actually most prevalent in adult women like Lauren. And in Scotland, as we've heard, 1 in 14 people are currently being treated for asthma. It's also estimated that occupational asthma accounts for 9 to 10% of adult onset asthma. It's widely accepted that commercial kitchens can both aggravate existing asthma and trigger it in people that have previously never had any symptoms. This is because commercial kitchens have a number of irritants. The use of powder substances like flour in daily use in most kitchens is one of the biggest triggers. Current advice for people who develop occupational asthma is to consider a change in role at their business or career. Now, that might seem like reasonable advice. Why would you continue to put yourself at risk once you know the triggers? But realistically, it isn't. Not when there are other options that could help you manage the problem and stay in the job you love. When reading about Lauren, her passion for her work shines through and comes up frequently. Nobody should have to choose between their passion and their health. The two don't have to be mutually exclusive. I said earlier this is a common condition, and kitchens aren't the only workplace where occupational asthma is prevalent. It's also triggered by allergens for hairdressers, agricultural, mechanics and healthcare workers. If there is something that can be done to mitigate the impact of occupational asthma or to ensure better outcomes when someone suffers from an attack, it should be done. Making sure that salbutamol inhalers are available in high-risk environments is an easy thing to do. We already know that it can be done because we allow non-prescription inhalers to be kept in schools. In conclusion, Mr Hosey, I'm sure the Minister and her government colleagues will be in support of these measures, but have to abide by the human medicines regulations. I urge her to commit to a review and request the relevant bodies to explore that these inhalers can be provided to commercial kitchens. Thank you.
Jim Shannon.
Thank you, Mr Chairman, and for giving me the opportunity to speak in this matter. I'm very pleased to see the Minister in her place, and I'm convinced I'm going to get a decent answer to my issues, and I think we're all convinced of that. We look forward to the Honourable Lady's contribution. Also thank the Honourable Member for Don Valley for setting the scene so very well, as he always does. In an item and a matter that's of some interest to me. I'm the party's health spokesperson here, so therefore these issues are ones that I want to be involved in. I'm also chair of the E-petition on respiratory health, so it's a topic which I have a particular interest in. And as the Honourable Lady Brother Glenn referred to earlier on, we will have a debate on asthma next week, and it could well be that the Minister will be responding to that debate as well. I suspect that the Honourable Lady will. Why am I interested, Mr Chairman? Well, I'm interested because I'm a health spokesperson, but also interested because my second son, Ian, when he was born, now he's a young man of 30-year-old now, so it's a long time ago. But when he was born with asthma and psoriasis, combination of the two. The doctor informed us at an early stage that the psoriasis and the skin problems that he had would disperse or diminish as the years went by, but that his asthma could probably increase as a result. And in a way, that's probably what has happened with him. So he takes one of those inhalers with him every day. And manages to control it in a way. But it does become a very personal matter for our family, but it's also become a personal matter for many others. Because when I, in my office, which is very busy, everybody's office is busy, I get lots of referrals on this issue when it comes to health issues. So, as many of you will be aware, I've been intimately involved in the drive to have asthma inhalers to be available in school for use by a qualified person for a child, which had medically documented the need for and permission for the use of salbutamol and other relief inhalers. It was essential if a child forgot their inhaler that the school nurse or the equivalent had the ability to provide and supervise the use of the inhaler, and I'm pleased that this was successful back home in Northern Ireland. The school nurse or the equivalent had the ability to provide and supervise the use of the inhaler, and I'm very pleased. Prescriptions are prepared for a specific person only. If someone other than the person named on the prescription buys or uses the drugs, that would be illegal. So the provision within schools for emergency inhaler use has various safeguards, and it's important to have them in place. A clinically trained and responsible person, usually the school nurse or someone equivalent, and acts as a guarantor of the appropriate use. The inhalers are held for specifically named children only. You cannot use someone else's inhaler, and the school nurse is legally permitted to prescribe the inhaler. Even more so now with COVID-19, of course, that you can't do that, and therefore the restrictions are very more stringent than perhaps even they were maybe a year ago or even further back. Therefore, in theory, I understand and agree with the emphasis behind the petition. However, I believe it to be right and proper that we also highlight the difficulties and the safeguards and the necessity for them. That there clearly are in place and need to be in place. A need for care in the widening of allowing prescription-based relief inhalers to be available to anyone on any occasion. In asthma, it is absolutely undoubted that prevention is better than cure. Always is in health issues. It's about diagnosis, about prevention early on. In June 2020, the Pharmaceutical Journal reported a substantial increase of 60% in inhaler prescriptions from the year prior to COVID and 2020. And I think we all are convinced, Mr Chairman, that those increases are down to the pandemic and down to the problems that people have and the dangers that people perceive to be as well. NHS data also showed a similar large increase in inhaler prescribing across the United Kingdom of Great Britain and Northern Ireland. In March 2020, 2.77 million prescriptions were made for salbutamol inhalers, a rise of 63% from the previous February. I know this has led to supply issues. So again, when the Minister is replying, perhaps we can have some reassurance that the supply issues for the inhalers have been addressed. as we've all had constituents who use their inhalers monthly, worrying that they wouldn't get the inhaler in Northern Ireland. Indeed, I hate to bring it up, Mr. Chairman, but the Northern Ireland Protocol is to blame for many things, and it's to blame for access for the salbutamol inhalers as well. Again, Minister, perhaps you might be able to give us some indication that will not be a problem in the future. People whose asthma has been well controlled for years and didn't use an inhaler are getting one, as I said, just in case. We all know that prescriptions are not handed out just in case. They are given only when the case is fully justified. And I have a concern if prescription medication is given out not as needed by a dedicated health care professional, but at random in different buildings. The extension, as in this petition, would have to be carefully considered. It's about getting it safe, getting it right, and doing it the right way, and we want to make sure that that happens. We would need more information to ensure that there was appropriate regulation, as there is with the current prescription service, by which your GP prescribes and a pharmacist checks the dosage and informs you how and when to take. I believe this is an imperative step in medicinal safety and to safeguard those young children who get it, but also for their parents to have peace of mind. I conclude with this, Mr. Chairman. I wish to be clear in my comments. Whilst the drive behind this petition is laudable, and it is, there is much work to be done to make it safe. And I ask the Minister in her response to reference the concerns that have been made as we seek to get the delicate balance, as we often do, of availability of salbutamol, exactly right, save lives in the process, but make sure that everyone is safe. Thank you.
Adam Kaiser.
Thank you, Mr Hosey. It is a pleasure to serve under your chairmanship, and I thank the honourable member for Don Valley for leading this important debate, and to all those who signed E-petition 57876, including the 981 in my constituency of Airdrie and Shotts. And like the honourable member for Rutherglen and Hamilton West said, this is a horrific tragedy that has impacted many people in the wider Glasgow area, including my constituents. And like the honourable member for Strangford said, it's something that's very close to his heart, and it's also something that's close to my heart, as I was diagnosed with asthma from a young age, and I always used, I couldn't say the whole phrase when I was younger, so I used to always call it my blue inhaler, and I've used the blue inhaler since I was a child. I'd like to start off by taking a moment to express my sadness over the death of Lauren Reid, who tragically died at the age of 19. She was working in a Glasgow city centre bar in February 2020, and although Lauren usually carried her inhaler everywhere on her, on that day she unfortunately didn't have access to one. And she suffered a devastating cardiac arrest and was rushed to hospital, but the damages inflicted to her brain by the asthma attack were simply too severe. And her mother, Elaine, was left with a decision that no parent should ever be placed in to turn off Lauren's life support. If Lauren had access to an inhaler, she may still be with us today. Lauren worked in an environment that posed a high risk to those suffering from asthma. The fumes and dust in commercial kitchens increased the likelihood of an asthma attack, and a recent study conducted estimated that 30% of asthmatic attacks are linked to the work environment. Yet for most workplaces, an emergency asthma kit is not available. And like has already been said, I welcome the heroic effort of Lauren's mum, Elaine Cunningham. Her campaign has attracted widespread public backing, including 1 million views on TikTok. And that's actually really important, Chair, because that campaign is then reaching younger people, ensuring that the impact of asthma and the use of inhalers is widespread. And it's highlighted the need for a potential change in the law around access to inhalers, and currently there's no healthcare provisions that allow commercial kitchens to hold the inhaler, and I understand that there's some hurdles to placing these types of inhalers in the workplace. These inhalers are, of course, prescription drugs, and they pose a serious health risk if they're overused, but we may potentially be able to overcome these hurdles. In 2014, Parliament passed the Human Medicines Regulation, allowing schools to hold inhalers for emergency use. And the changes in the regulation allowed inhalers to be stored in schools without prescription, and this change has almost certainly saved lives. As has already been stated by my honourable friend, the member for Rutherglen and Hamilton West, asthma is one of the most common allergies across the UK, with millions of people across the UK diagnosed, and myself included. Every 10 seconds, someone has a potentially life-threatening asthma attack, and sadly, Chair, 3 people die. It's estimated that 2/3 of these deaths could be prevented by routine care, and an estimated 4 out of 5 people with suspected severe asthma who should receive specialist care are unable to, meaning that they are missing out on life-changing treatment, and this has a negative impact on the NHS in the long term, with treatment for asthma patients costing the NHS £3 billion per year, making it one of the costliest conditions to treat. And as the Honourable Member for Don Valley stated when he introduced the debate, deaths caused by asthma are 50% higher here in the UK compared to the EU, and we have the worst death rate in Europe for young people aged 10 to 24 with asthma. Chair, we're not doing enough, and we can do more. Improving access to inhalers in commercial kitchens may just be one small step, but it could potentially make a huge difference. And we can do more across these 4 nations to combat asthma. In Scotland, we're taking these steps and to make these changes. When changes to regulations occurred in 2014, the Scottish Government engaged in consultation with Asthma UK and worked alongside them to implement the policy correctly in schools, and guidance on their use was developed in partnership with key stakeholders from NHS Scotland and education authorities to ensure that inhalers were used correctly in schools. Chair, Elaine's campaign has already received the support of UniChef, who are the national union that represent kitchen chefs, which shows that there is a level of support within the industry for these proposed changes. And I hope that the government will engage with stakeholders to have these really important conversations to potentially make these changes happen, and I welcome the Minister's comments on this. More generally, the Scottish Government will continue to do all that it can to combat asthma, and recently the Scottish Government announced the Respiratory Care Action Plan. The plan set out a vision for the Scottish NHS and prioritised the need for more preventative measures to combat respiratory conditions, including asthma. And the need for action on asthma has only increased since the pandemic, with the number of undiagnosed cases only increasing each year, or since last year, sorry. The Scottish Government are committed to ensuring that meaningful data is provided on asthma cases to help understand where people's needs are not being met and to deliver the most effective person-centred care. The Scottish Government will continue to work with stakeholders in the implementation of this plan. And Chair, I do need to mention that the UK Government should follow the lead of the Scottish Government in the provision of free prescriptions. Since 2011, those suffering from asthma have had access to free inhalers in Scotland, meaning no person is left without an inhaler. A recent survey conducted by Asthma UK found that 3/4 of people living with asthma in England struggled to pay for their prescriptions. Often individuals have turned to skipping doses for their inhaler to cut costs, posing a risk to their own health. And the UK Government should follow the Scottish Government's leads and provide free prescriptions to those who suffer from asthma. It's been almost 2 years, Chair, since the tragic death of Lauren. What the petition is proposing will save lives, And we simply need to do more to ensure that there's more access to inhalers for Elaine, for Lauren and for all those like me who suffer from asthma.
Alex Norris.
Thank you, Mr Hosey. It's a pleasure to serve with you in the chair, and I'm grateful for this chance to speak for the opposition in this important debate. And I start by paying tribute, as other colleagues have, to young chef Lauren Reid, whose tragic passing last year leads us to today's debate. Described by her mum as the most amazing, kind, beautiful, caring person, may we turn this family's heartache into action and look at ways we can prevent this from happening again. I also pay tribute to Lauren's mum, Elaine, who's been spearheading this campaign, and I send my thoughts and prayers to Lauren's family and friends, and also to her colleagues, and hearing what the Honourable Member for Don Valley said about their experience in that moment and their efforts. I send them my solidarity too. And then finally, securing a debate through this petition route, Mr Hosey, is a very hard thing to do. 100,000 is an awful lot of signatures. So I think that speaks to the seriousness of this case and how strongly people feel about it. And I commend those who promoted it, organised it, and all those who signed it. The Honourable Gentleman, the member for Don Valley, had the difficult job of opening this poignant debate. And I thought he did a very good job of that and made a very thoughtful case. I particularly was struck with two things that I may speak a little bit about more myself, but firstly around the context with asthma in this country, and then secondly about the risks in commercial kitchens, which I think is what makes this a very compelling individual case beyond the broader national messages around asthma. There were also similarly thoughtful contributions from other colleagues. The Honourable Member for Rutherglen and Hamilton West, in setting out just how common that asthma is, I think that behoves us as a national legislature to act on behalf of that significant portion of our population. I agreed with her when she talked about perhaps those who are at risk having to change their role. I don't give that much succour to. I wouldn't want to give up my dreams for something that a reasonable adjustment could avoid that, and I wouldn't want that for anybody else either. And I think we'll look forward to the Honourable Member for Strangford's debate on asthma, where we'll be able to continue some of the themes that we've had. But I thought particularly at this point, the points that he made around schools were very interesting, because that offers us in this debate an analogous example that reads across what Elaine and her family are asking for is working somewhere else. So that I think is very useful for us. But also, I think the points that he made around safeguards was something that would be shared by all of us, and we would all want to see that too, because we are conscious about the risk around prescription drugs. But what is it, to make some points of my own, Mr Hosey, what's at root here is a simple argument, and that's to permit the availability of salbutamol inhalers in commercial kitchens. Now, this is a campaign that's backed by UniChef, the Chefs' Union, and others like the GMB, my own trade union, and they're calling for an exemption to be made where commercial kitchens can be supplied and administer, and they can administer inhalers in emergencies. And this, in their response, the government has said that this is something that the regulator would need to approve, and if they see benefit, to pursue through public consultation. I hope the Minister will update us on progress of her discussions with the licensing authority, and similarly to whether she'll be able to tell us if she's engaged with the Royal Pharmaceutical Society around perhaps draft guidance once the licensing authorities made their considerations. It would be very interesting to know what progress has been made between the official response to the petition that the government made and today. Turning to asthma more generally, Mr Hosey, 57% of healthcare professionals have had patients who have had an asthma attack or needed emergency care because that individual, for whatever reason, did not have their medication with them. It happens. Life happens. These are things that any of us, errors that any of us could make, particularly living busy lives. And it is a big group of people, as we've heard, 5.4 million people in the UK receiving treatment for asthma, and leading to 41,000 hospital admissions due to asthma-related concerns alone. And last year, 1,300 deaths. This is a really significant issue and requires significant action, I believe, in this place. And that rate, as the Honourable Member from Airdrie and Shotts has said, actually has increased recently. And we are, again, as the Honourable Member said, we are an outlier relative to our neighbours, with a 50% higher than average death rate in the European Union. So, again, I think that calls on us to understand the challenges in our country and to look at what we might do differently. And this certainly is one of those things we could do differently. And as multiple honourable members say, a commercial kitchen, the reason that this is a distinct setting that deserves special consideration from us today is that it is a potentially risky environment with triggers like flour, fumes, heat, dust, odours, a lack of decent ventilation. So this is something, again, that it is perfectly reasonable for us to be considering to see if we might do better. Because everybody should be safe at work and everybody should have safety nets at work to help them. And we do know, as I say, the example from schools is a clear one, but it has been possible in the case of schools to make an exemption in Schedule 17 of the Human Medicines Regulations to allow the sale of and supply of salbutamol inhalers and EpiPens to schools for use as an emergency. So this is not something that's asking for something that can't be done. I want to make a couple of very brief points about the regulator itself. We are very, very well served in this country by the Medicines and Healthcare Products Regulatory Agency. It's a very important body, exceptionally important body for all of us at some point in our lives. Whatever medicine or medical device we may need, that goes through there, and they're the ones that tell us that it's safe for us to use. So we all rely on them. But they're a very busy regulator too, because you think at the pace of change in that market is significant both domestically and globally. But also recently in this place, we put a significant number of new responsibilities on them through the Medicines and Medical Devices Act that received royal assent earlier this year, Mr Hosey, which was in part a response to our exit from the European Union and the change in the regulatory environment that came from that. So they are on a high wire, the MHRA. And they have a life and death job. That is not overhyping it to say it's a life and death job. And we're cutting their staff. We're going to make a 20% cut to their staff, Mr Hosey. I cannot see that as a wise idea that at a time when we're actually asking them to do more, that now, because their income from the European Union has dried up, we are now reducing their staff. And I hope the Minister might reflect on that and perhaps could give us some assurance that ministers are actively looking at that decision and seeing what way they can make sure that doesn't happen, because I don't think that promotes patient safety in this country. So to conclude, Mr Hosey, it is right that we listen to that regulator first, before we act in this area. But what is being proposed here is reasonable. It has a comparative example, so it's feasible as well as being reasonable. So I hope the Minister will be able to address the questions of my own and honourable colleagues, and give us a sense of what conversations are going on and what her sense of timetable is too, because people will be watching today. I hope they will feel that we have done this really, really important issue justice. I think we have, but they'll want to know where this goes next, so I hope we hear that from the Minister too. Thank you, Chair.
Gillian Keegan, Minister.
Thank you very much. It's a pleasure to serve under your chairmanship. And I want to also start by acknowledging the tragic death of Lauren Reid, aged just 19, with so much to live for, having achieved so much already, and to offer my sympathies to her mum Elaine and to her family and friends. I also want to thank my honourable friend, the member for Don Valley, and all those who signed this petition for ensuring that this issue was brought to the attention of the House, and all those who've taken part in the debate today. Mr Hosey, Chair, the Government responded to the petition to allow wider availability of non-prescribed salbutamol inhalers on the 25th of August, and I'd like to build on this response in my speech today. Asthma inhalers are a mainstay treatment for patients with acute asthma. The ready access to a prescribed inhaler can save lives in an emergency. And the supply of prescribed medicines, including inhalers, is of course carefully and thoroughly regulated in the UK through the Human Medicines Regulations. And these control the safe sale and supply of medicines in the UK. Some medicines are classified as prescription-only medicines because they could result in harm if they're used without medical supervision, and even if used correctly, or they are frequently used incorrectly and may cause harm as a result. And prescription inhalers are in that category. The Medicines and Healthcare Products Regulatory Agency, or MHRA, as the licensing authority in the UK, has advised that exemptions can be made in the relevant human medicines regulations, and any such change would depend on the careful and thorough review of evidence to support the change. As the Honourable Member for Strangford says, we need to do this very carefully and make sure safety is at the heart of everything. We need to ensure the benefits of such a change would outweigh any risks, and any change would also depend on the advice of our independent expert advisory committee, the Commission on Human Medicines, or CHM. I'm pleased that the MHRA met with my honourable friend on the 25th of November to provide detailed advice on the type of information that would be needed to support such a change. And I understand the discussion focused on the evidence needed to enable a full assessment of benefits and risks by the MHRA and the Commission on Human Medicines. And I hope my honourable friend found this helpful. For the benefit of the House and for the record, I will give some detail on this. The sort of evidence that is needed would clearly show the intended benefits. That includes outlining the magnitude of the issue in question, such as how many people are affected by serious asthma attacks and the locations where having such medicine available would be of the greatest benefit. The evidence would also need to consider any risks and how they could be managed. For example, that the medicine could be stored, handled and used safely in an emergency. Once adequate information is collected, the MHRA seeks independent advice from the Commission on Human Medicines. And at this stage, they would also consider any guidance to stakeholders, you mentioned guidance, on the necessary safeguards that would need to be in place. Feedback from a public consultation would be considered before a final decision on implementing any legislative change. The MHRA welcomes any submission of evidence from interested parties and is committed to ensuring the UK becomes an even greater place to develop, manufacture and supply medical products, and most importantly, that we have continued access to safe medical products. I'm aware that previously an amendment to the Human Medicines Regulations was made in October 2014 to allow schools to procure and store non-prescribed salbutamol inhalers, as many honourable members have mentioned. And at that time, the potential advantages and disadvantages were tested with the use of pilot schemes. And these schemes placed inhalers in some schools and tracked their usage. And information was collected by surveys of patients, teachers and schools and analysed by the MRHA and CHM. So the Health and Safety Executive, or HSE, owns guidance on reducing the risk of asthma in the workplace. And the department will be looking further into this matter along with HSE and MRHA. And once this information sharing exercise has taken place, the department will be in a better position to decide whether further action needs to be taken. And the department will explore commissioning research so that we could examine further this issue. I've heard the amount of concern that there is in this House on this issue and indeed amongst the wider public. Thank you to all those who have taken part in the debate, and thank you mostly to the 102,058 people, patients, stakeholders and families of asthma sufferers who signed this petition. And if I may, I would also like to update the House on additional public health measures that we have put in place to improve outcomes for people with asthma. The NHS Long-Term Plan, published in 2019, sets out commitments and objectives for the NHS for the next 10 years, and this includes respiratory disease as a national clinical priority and aims to improve outcomes for patients, including those with asthma. The respiratory interventions proposed in the NHS Long-Term Plan include early and accurate diagnosis of respiratory conditions, and to diagnose conditions earlier may prevent avoidable emergency admissions for asthma. Pharmacists in primary care networks will undertake a range of medicine reviews, and this includes education patients on the correct use of inhalers. And since 2019, several initiatives and publications have been announced in support of the long-term plan. NHS England and Improvement's National Patient Safety Team has prioritised work on asthma as part of the Adoption and Spread Safely Improvement Programme. This will support an increase in patients in acute hospitals receiving every element of the asthma discharge care bundle from 38% to 80% by March 2023. And from April 2021, the Academic Health Science Networks in England, in partnership with the Patient Safety Collaboratives, are working with provider organisations to improve the uptake of all elements of the asthma care bundle for patients admitted to hospitals in England. Compliance with the elements of good care described in the bundle are measured as part of the National Asthma Audit. The care bundle includes actions that should help to reduce the number of patients who are readmitted following discharge and ensure that all aspects of the patient's asthma care are considered. The bundle assesses inhaler technique and includes care follow-ups. These interventions should prove more beneficial than relying on emergency use inhalers to provide temporary relief. And just in reply to the Honourable Member for Strangford's question, the Department works closely with the MRHA, the pharmaceutical industry, NHS England and Improvement and others operating in the supply chain to help prevent shortages. And the team has advised that there are currently no shortages in the supply chain. So to close, I would like to take a moment to remember Lauren and to send her sympathies to her family and her friends. And I want to thank all those involved for bringing forward this important debate. I hope what I've set out today demonstrates our commitment to this issue. We do want to facilitate changes that will protect public health, so we will look into this with the relevant bodies, and we are working hard to make sure that asthma care improves for all, as outlined in the NHS long-term plan, and that asthma sufferers have access to the best care available. Thank you.
Nick Fletcher to wind up.
Thank you, Chair. I thank all members for their contributions this afternoon. I thank the Minister and you, the Chair, the petitioners, the MHRA for meeting me, but most of all, Elaine, Lauren's mum. As I said when I met Lauren's mum, I cannot promise that Lauren's law will become legislation, but we have a wonderful Minister who's just given a wonderful speech, and so there's an awful lot of work going into looking after people with asthma. And I'm sure if Elaine continues campaigning, and with the support of many members, including myself, hopefully we can get this Lauren's law passed through. A loss of a daughter is something no one should go through. But at least by raising this issue, hopefully Lauren's memory will be a lasting one that gives the opportunity for many people to work safely in commercial kitchens, doing what Lauren loved to do so much. Thank you.
As this House has considered E-petition 578676 relating to access to salbutamol inhalers. As many as there are of that opinion say aye. Of the contrary, no. The ayes have it. The ayes have it. Order, order. The sitting stands adjourned.
Grand Committee Room ident.
The proceeding has ended.